I do have concerns as a parent already to 2 other children, that as a pregnant woman, if I do get swine flu, how it affects me and therefore my other children.
Well, let's now go to our doctor in North London. That's Dr. Ellie Cannon. I don't know how much of that you heard, Dr. Cannon, but Debbie alongside me, who is expecting a child, is concerned about say it again?
Adjuvants.
Adjuvants, yeah. I mean, you know far better than me, which apparently are an ingredient of this particular dosage. Can you put her mind at rest?
Well, I think it's very important that our patients have looked into the safety of the vaccinations that they're going to be taking. What I can say about adjuvants is adjuvants are very common in a lot of vaccines that are very well used across Europe and in England, and we're very used to having that as part of our vaccinations already. And I think people are concerned because they feel the vaccination has come out so quickly. But what I'd like to say to that is the seasonal flu vaccine that we use every year is always produced very quickly. And nowadays virologists say that the techniques are so sophisticated in making vaccines that making a vaccine so quickly is not equated with it not being safe.
Okay, but her point was that this hasn't been tested on, in her view, hasn't, or as far as she knows, hasn't been tested on pregnant women. Is that true?
I think there are studies that have been done on pregnant women, certainly in Europe, and I think what we have to look at with all medications is looking at the benefits versus the risks. And what we do know that the risks of having swine flu, as we have seen with the fatalities of pregnant women with swine flu, the risks in this case are huge from having swine flu when you are pregnant, and therefore we can outweigh that with taking a vaccine.
If that's the case, why is it, do you think, that so few health workers apparently volunteer themselves for this? Less than 20%, according to the information I was reading.
Yes, I'm not sure why that is. I know, for example, in my own practice and from my own point of view, I will be taking the vaccine because I am a frontline healthcare worker, and I firmly believe it is safe, and that's why I will be going with the advice that I'm giving my patients.
Okay, well, we don't know why the others are thinking, as I say, negatively perhaps, or maybe they're just not bothered, maybe they don't think there's a problem, but that is a fact. Are you reassured by any of that?
No, I'm not. I wonder if the doctor would still take the vaccine if the doctor was pregnant herself.
Yeah, quickly answer that question for me, Doctor. Would you take it if you were pregnant?
Yes, I would.
There you go. Just make up your mind time, I'm afraid. But thank you very much to you, Dr. Cannon. Thank you to you, Debbie. Hope you'll reach a conclusion pretty soon, I'm sure. Find out more information on swine flu, plus take Dr. Hillary's online symptom checker test by logging onto the website, gm.tv.
It's 6:27. High time we got the weather. Here's Kirsty.
GMTV weather, sponsored by Nestlé cereals.
It's humanity, but has vowed to boycott the proceedings. Pregnant women are among the high-risk groups who will be invited by their GPs to have the swine flu jab from this week. The national programme is being stepped up, with 4.5 million doses of the vaccine being delivered to doctors' surgeries. Miranda Shunker is in North London. Miranda, what's in store then this week?
Good morning, Helen. Well, it's a huge logistical operation.